Hello, my name is Rhonda Dickman. I'm a registered nurse and clinical quality improvement specialist with the Tennessee Hospital Association. I help lead THA's efforts to support hospitals in sepsis mortality reduction. And today I'll be talking about key components of a strong sepsis program. There are many benefits to having a sepsis program, which is basically a pre-planned, coordinated approach to the identification and treatment of sepsis patients. And these include improved patient outcomes, improved worker satisfaction, improved core measure compliance, and optimization of documentation to aid in the accuracy of coding and prevention of claim denials. The key components include having a supportive culture, designing effective systems, training and competency, monitoring and improvement. A supportive culture begins with sepsis being an organizational priority. There's value to hospitals to looking at the impact of sepsis on their patient volumes and reimbursement and comparing that to other diagnosis groups. This can aid tremendously in the design of the sepsis program. A supportive culture also includes executive leadership, sponsorship, and support. And this would include such practical tasks as being supportive of a sepsis team, participating in the team, making sure that the sepsis goal is on the organization's quality and safety dashboard, which is reported to the board of directors, that there's support for training and competency time, and also promotion of the sepsis protocol. Since this is such an important part of the success of the program, I've provided some additional details on this executive role. That the executive sponsor assumes that executive level responsibility for the outcome of the program. They charter the program, they confer authority on the program lead and team members, they support the team's quest for resources and visibility, they ensure the presence of and support team values such as accountability and transparency. And when the team faces difficulties or is coming up against organizational interference, they intervene and provide assistance. They stay involved and interested, and they hold themselves as accountable to the program's success as they hold the program lead and team members. A supportive culture, lastly, includes physician champions, and this may be one or several depending on the size of the organization, and might include an emergency department physician, intensivist, pulmonologist, hospitalist, or an infectious disease doctor. And these physicians should be active with the sepsis team, committed to the organization's sepsis goal or goals, and definitely participate in the design and improvement of the sepsis protocol and assist with training, competency, and feedback, particularly with their provider colleagues. In designing an effective system, it's important to begin with establishing oversight. And this is often done in two ways. First, to have a sepsis coordinator or a person who is designated as a sepsis program lead. And secondly, that an interdisciplinary sepsis team is established or sepsis is incorporated into an existing interdisciplinary team to help support and design the program. An effective system has sepsis program goals, and these might include, for example, to reduce mortality or improve core measure compliance. In a small and rural hospital that mostly treats sepsis in the emergency department, that goal might be to reduce time to transfer. A sepsis protocol should be developed. This is a critical document and should be built with consensus between physicians, executive leadership, the disciplines involved in the care of the sepsis patient, patient safety and quality management, health informatics, and clinical documentation specialists. And within that protocol, there should be a sepsis order set. This should be provider driven since they are the user of the order set, but it should involve key stakeholders such as pharmacy and nursing who will be looking to that order set to deliver care to the sepsis patient. An effective system also includes other key sepsis-related documents that support the care of sepsis patients. And these may include a screening tool, a specific sepsis progress note, clinical pathways, both for ICU and wards, a sepsis-specific handoff communication tool, or patient and family education materials. Hospitals may wish to consider a sepsis alert or code sepsis that's based on their unique needs and the patterns they see with sepsis patients. A small rural emergency department, for example, may want to implement a code sepsis protocol to bring lab personnel and the nursing supervisor to the emergency department quickly to aid in treatment. Whereas a larger organization may implement a sepsis alert that fires from a medical record program that's screening in the background for criteria for sepsis, that a sepsis coordinator or critical care nurse responds to and evaluates, and then activates the rapid response team as needed. Departments such as the laboratory and pharmacy should make sure that they have well designed the systems needed to ensure smooth sepsis care. And these would include prompt blood culture collection, prompt lactate testing and resulting, and some discussion about point of care testing would be appropriate. And then for pharmacy, making sure there are processes for timely ordering, dispensing, and administration of antibiotics, and also the availability of common vasopressors and IV fluids. And then other departments and technologies as needed, such as respiratory therapy, or if non-invasive hemodynamic monitoring is used, that's available and staff are trained. And that leads to training and competency. A strong sepsis program has a staff education plan that includes all clinicians that are involved in caring for sepsis patients. The type and frequency of training is tailored accordingly, with a goal to improve recognition of sepsis and implement the sepsis protocol timely and accurately. And the plan should include ongoing competency and how that will be maintained. I provided one resource here for you from the Colorado Hospital Association, who has put together some great materials on sepsis simulation exercises. Lastly, a strong sepsis program includes monitoring and improvement. The sepsis team should develop a sepsis action plan that clarifies the goal and the steps for accomplishing that goal. They should establish and track sepsis metrics that include outcome, process, and balancing measures. For example, the outcome measure of reducing sepsis mortality, a process measure of reducing time to antibiotic, and a balancing measure perhaps of blood culture contamination rates. Are we hurrying a little too much to get that antibiotic in and getting clumsy with blood culture collection procedures? A dashboard should be established for displaying the results, and then a reporting plan should be also made as to what information is going to go to whom within the organization. There should also be a feedback plan for the nurses, physicians, and perhaps other clinicians who are caring for sepsis patients, and this should utilize principles of just culture. This is not to point the finger at someone who may have missed something, but to examine the sepsis protocol and the system that's been put in place for sepsis identification and treatment so that you can see what's working, what isn't, and use that information to strengthen the sepsis program. In summary, strong sepsis programs improve patient outcomes, improve staff satisfaction, and aid in the accuracy of documentation, which is important for core measure compliance and accuracy of coding. A strong program includes a supportive culture, the design of effective systems, training and competency, monitoring and improvement. If you would like more information, please reach out. I could provide links to the recordings of a webinar series by Angela Craig of Cookeville Regional Medical Center on the components of a strong sepsis program, and may have other ways that I could be of help and assistance. Thank you.